oblique transverse abdominis fibers. And then up here, this is called the spermatic fascia. Spermatic fascia is pretty much the same as this except for two things. It doesn't have peritoneum on the deep side, and some of this does. Peritoneum is technically called tunica vaginalis, but those terms are sometimes used interchangeably, so sometimes the whole thing's called tunica vaginalis. I really don't care which one you call it, either one's fine. But you see that there's muscle here. See this is corned beef, right? So this used to be the internal abdominal oblique. So when the testicle pulls those aponeuroses, it also pulls these muscles, fibers with it. This is used for thermoregulation.
Would you say external?
Internal abdominal oblique. So when the testicle gets cold, these contract and pull the testicle back toward the body to warm it up. There's also another muscle out in the scrotum, okay, and that muscle is called the dartos, that's smooth muscle. And when the testicle gets cold, that contracts and pushes the testicle toward the body. So the two work in concert. Okay. If we pull that back, I want to show you something kind of interesting. If I take and hold the fascial sac, see how the testicle doesn't fall out? It's attached right here. The thing that's attached right here is the same thing that we had in the female. Remember the round ligament of the uterus? That's the same thing as this. This is called the scrotal ligament sometimes. It's what's left of a duct that we will talk about in lecture called the gubernaculum. Okay. Then on the testicle we see this thing that looks like a tadpole. That's the epididymis. So we have a head, body, and tail of the epididymis. And then we have this outer covering. This is a tunica albuginea. Okay. And that's actually a generic name. So you'll see there are other organs that have this outer coat as well. Tunica albuginea is a generic name. And then inside is where meiosis occurs, where the spermatozoa develop after puberty, and they're in these little tubules that are microscopic. Those are called seminiferous tubules, and they get pumped from there once they are formed into another set of tubules that are also microscopic called the rete testes, and then they get pumped from there into this central set of tubes, which I can tag and which you can see. It's this kind of spongy stuff right up the middle, and that is the vas efferens with two F's. So, if you follow the Great Sperm Adventure, they start in the seminiferous tubules, they go to the rete testes, they go to the vas efferens. Vas efferens, there are a whole bunch of them, and I've forgotten how many, but it seems like they're like on the order of 20 or something like that. They come up to the head of the epididymis, and they converge, and they all release the spermatozoa into a single duct. It's called the duct of the epididymis. And that duct coils back and forth inside the epididymis. So in a human, the epididymis is about that long, and the duct of the epididymis is about 20 feet long. So you have this 20-foot tube inside of this really small, maybe 2-inch, 2.5-inch space. So that's obviously going to be miniaturization also. It's going to be a small tube. The spermatozoa have to stay there if they're going to develop normally. It takes them about 20 days, so pretty close to 3 weeks. And while they're there, they grow the flagellum, and they change their shape so they kind of become streamlined, so it's easier for them to swim. And then if the person ejaculates, they come out of the tail of the epididymis, and they go into the next tube, which is called the vas deferens, with one F. And the vas deferens is inside that spermatic cord. So this vas deferens is inside here, okay? And then we saw vas deferens up here. Remember that was the thing I pulled on? That little tube. Goes down the posterior side of the urinary bladder, still vas deferens. It meets another duct called the seminal duct. And the two come together again like a Y. So you have the vas deferens, seminal duct, they join, and the single duct that comes out is the ejaculatory duct. The ejaculatory duct punches through the prostate gland and dumps its contents into the urethra. The contents are going to be the spermatozoa and the seminal fluids. Prostate fluids go into the urethra as well. And then all of that gets pumped down through the penis. The bulbar urethral glands dump some more mucus secretions into the urethra. That neutralizes any urine that might be there. Because urine tends to be acidic, that would kill the spermatozoa. And then these spermatozoa leave the penis and normally are deposited in the vagina if fertilization is going to occur. So there's some variations on that theme, but if you're going to have fertilization, that's where they go. Okay. Then from there, they have to swim. So they swim through the vagina to the cervix, through the uterus, and out through the uterine tube. And then the fertilization usually occurs in the distal third of the uterine tube, which is where it's closest to the ovary. So if you look at that, there's 11 things. The seminiferous tubule, reedy testes, vas efferens, epididymis, vas deferens, ejaculatory duct, male urethra, vagina, cervix, uterus, oviduct. 11 structures. Now, a couple of things. Temperature is important. Obviously, having testicles out here is sort of has its drawbacks, especially if you ride a bicycle. So the obvious question would be, why in the world would testicles be out here where they could be damaged? And the answer is because of temperature. The ovaries are inside, right? But the meiosis is all done with the ovaries by the time a person's born, so it doesn't happen. But to have that all carried out, you really need to have the testicle about 3 to 4 degrees Celsius cooler than the body temperature. So in a human, it's going to be about 90 degrees Fahrenheit. So if the testicle's too warm, the spermatozoa don't develop normally. So one of the things that people occasionally have is fertility help because they're trying to have